Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about Charcot Neueoethropathy, or the Charcot Foot, or Charcot associated with peripheral neuropathy. So Charcot is a rare serious complication that can affect people with peripheral neuropathy, and especially those with diabetes. So having Charcot doesn't mean you have diabetes, it just means you have neuropathy. Peripheral neuropathy. Charcot affects the bones and the joints and some of the soft tissues in the area. The bones become weak. They almost become soft, and you get some abnormal fracturing, abnormal flattening of the foot, for example, where the joints fail and the foot kind of just collapses. In the early stages, it becomes a significant deformity of the foot and can actually even create pressure sores or wounds to the bottom of the foot. So the goal of diagnosis and treatment of the Charcot foot is take the weight off the foot, so you're basically stopping the continued progression of the disease. So it's not getting worse. You're not continuing to fracture the foot. Treat the bone disease and prevent new foot fractures. So the idea, the earlier you catch it, the better chance you have of having a more functional or normal foot. But the whole point is to recognize it and then treat it to reduce problems, reduce cause issues, and so forth. So how would Charcot foot be diagnosed? And it's really there's several different steps of diagnosis. So the idea is the foot's going to be red, warm to the touch, and there's significant swelling in that extremity initially. And then when you go from there, you're going to say, okay, x-rays are valuable, especially in early stages. X-rays in the very early stages can be normal, but as the foot progresses, you start to see the signs that are consistent with peripheral neuropathy. Charcot foot is something that you should be thinking about anytime you start seeing abnormal fractures in the foot of someone that has peripheral neuropathy, or you see an increased skin temperature of the affected foot. So as we talked about the different treatment options. The big thing is typically you'll be put in some kind of a cast or boot or something that actually takes the pressure off that foot so it can't continue to progress. A lot of times it will be supportive in such a way that it keeps it from getting worse, and you're going to treat any wounds or sores or anything related to that. So if you have abnormal red, hot, swollen foot, you don't know exactly why you have peripheral neuropathy, and you're wondering what's going on, the best thing to do is be evaluated and determine if you have either a fracture that you didn't feel because of peripheral neuropathy, or even worse, the progression of Charcot, which needs to be treated really, really aggressively, including cast, bisphosphonates, or other supplements to actually reduce the treatment. If you catch it early on, you can a lot of times do non-surgical treatments. If it's later on, a lot of times you need to do a surgical repair, which may include things such as rigid fixation inside the foot. So this is Dr. Brandt Gibson, and this is your Podiatry Tips Day 133.